Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
So now let us learn some differences between the pyogenic abscess. So different abscesses, differences between pyogenic abscess, amoebic abscess, and hydatid cysts. So differences between pyogenic abscess, amoebic abscess, and hydatid cysts. So if you see the differences between pyogenic abscess and amoebic abscess and hydatid cysts, we will see. Okay, first what is the most common symptom? Okay, most common symptom in pyogenic liver abscess is fever. Most common symptom in amoebic liver abscess is right upper quadrant tenderness. Most common, sorry. Most common symptom in pyogenic liver abscess is fever. Most common symptom in amoebic liver abscess is abdominal pain is the most common symptom in amoebic liver abscess. Actually, hydatid cyst is asymptomatic most commonly, but if you have to select one, then it is abdominal pain. Okay, most common symptom in amoebic liver abscess is abdominal pain. Most common symptom in hydatid cyst is asymptomatic, but if you have to select one, you can select abdominal pain. Then what is the most common sign? Okay, most common sign in pyogenic liver abscess is right upper quadrant tenderness is the most common sign. In amoebic liver abscess, most common sign is hepatomegaly, whereas most common sign in hydatid cyst is right upper quadrant mass is the most common sign in hydatid cyst. Then what is the most common lab abnormality? Okay, most common lab abnormality in pyogenic liver abscess is raised alkaline phosphatase levels, whereas most common lab abnormality in amoebic liver abscess is raised prothrombin time. Most common lab abnormality in hydatid cyst is eosinophilia is the most common lab abnormality in hydatid cyst.
thank you and thank you for watching.